Good morning, everyone. First of all, I want to thank Dr. Manohar Kehan for inviting me to chair this session. Since we are running short of time, without wasting much time, we'll go directly to the next lecture by Dr. Vinay Devraj on the topic Prophylactic and Preventive Measures for Dengue Disease, including vaccination. Over to Dr. Vinay Devraj. Thank you.
Thank you, sir. Thank you, Team Disha and Takeda, for this opportunity to be here. Right. So, though the topic says a comprehensive preventive measure for dengue, so we know by and large, the preventive measures are something with regard to preventive and social medicine, mosquito control measures, hygienic improvement measures, all those that will not be discussing. So primary mode and the point of discussion today will be about the new vaccine, which could hit the Indian market by the end of the year or next year, not too certain. So we are going to discuss about the TAC 003 vaccine from the company Takeda, which might come into India at any point of time. And contrary to what the slide says, I have no direct communication or connection with Takeda, but I'm giving an organized sponsor talk from them, but all the content discussion will all be critically analyzed scientific ones. So why the need for vaccine? Answer is quite simple, as we all know, because the global burden of dengue is humongous and it is constantly increasing. On an average, there are close to around 40 crore infections worldwide every year, estimated around 5 lakh hospitalizations and around 40,000 deaths, which makes dengue as one of the most common leading infectious diseases and also one of the most common killers across the world. Important thing here is, among the symptomatic patients, 1/3 of them have severe dengue. We all know the WHO classification of it. And severe dengue, more often than not, is a risk marker for high mortality. So we also know that the dengue burden is on the rise over the past 2 decades. It has increased manifold, close to 10-fold increase over the last 20 years for the reason of expanding urbanization, too much of builds, destructions everywhere, and also increased travel. The burden in India is not too different from the rest of the world. India is one of the endemic to hyper-endemic country with regard to dengue. So the data shows in the last year itself, there were close to 1,20,000 cases, even though it was not an epidemic or an outbreak phase last year, and close to 131 deaths, which is still a significant number. But we all know when it comes to any topic for that matter, any disease for that matter, the burden of data is always less. We are underrepresenting our own data. So the importance why we discuss so much about dengue is, like I already mentioned, 1/3 of symptomatic cases, admitted cases, end up to be severe, and in them the rate of mortality is pretty high. So dengue, of course, is something which we need to look upon with utmost seriousness, because when it comes to adults, there are various risk groups and risk factors which increase the chronicity to dengue. So as per multiple research, it is seen those with diabetes and heart disease have the maximum propensity to get infected, maximum propensity to be symptomatic, maximum propensity to have severe dengue, and also the death rates are high in these groups. With India being nearly the capital of people with increasing cardiac diseases and diabetes, so dengue becomes one of the most important, should be preventable infectious disease across the world, especially in the Indian subcontinent. So why do we need a vaccine? Like we already discussed, it is an infection which does not have specific therapeutics as such. So you are at the mercy of the disease per se. If an individual ends up with symptomatic dengue, so you hope that he doesn't get hospitalized. If he gets hospitalized, you nearly hope that he doesn't get severe dengue. And if he gets severe dengue, you always hope that it doesn't end up in mortality. So by and large, with the physicians, the hands are tied when it comes to dengue. You can't do much except do supportive measures and may not be beneficial always. If not prevention of death, one thing dengue does is it prolongs the morbidity. So during the course of illness and also after, the amount of suffering is too much, and like I said, since it does not have specific therapeutics, does not have any specific management as such, we need to have a good preventive measure, and vaccine is what can lead us to that. And that's the need for tetravalent vaccine, for the reason that all 4 serotypes of the dengue virus can be detrimental, and we all know that if at all there is a secondary infection, somebody has had dengue before, he ends up with another dengue episode, the mortality tends to be high, morbidity tends to be high, the duration of suffering and the chronicity for severe dengue is also quite high. For that reason, prevention is of course better. So an ideal vaccine when it comes to dengue is something which could trigger or should trigger all arms of the immune system, should be safe, effective against all 4 of the serotypes, should be able to cover even when there is an epidemic outbreak and reduce the burden of disease, and should be good enough, cost effective enough to fit into all the immunization programs. So within the background, with many previous attempts at dengue vaccine being a failure, so TAC 003 was an important advance and important upgrade with regard to vaccines as such. It is a recombinant tetravalent, meaning covering all 4 serotypes, live attenuated vaccine, which primarily has a dengue virus type 2 backbone. Reason is simple, dengue virus type 2 is the most prevalent and most severe of all the dengue serotypes. The backbone is of that, and there are many gene mutated or gene involved proteins from the other serotypes as well. What it does is it covers all the essential trigger proteins from all the serotypes. So we know that NS1 protein response results in severity of dengue, and for the rest of it, it determines whether or not an individual becomes symptomatic. So if you can encompass these as antigens and induce good antibody response, so as and when the infection sets in, the vaccine should be able to give us ready-made immunity, and that is the whole purpose. And it does also. So the TAC 003 vaccine has shown in clinical as well as lab-based studies that it can trigger all arms of the immune system. It triggers a good innate response, a long and sustained humoral antibody response, and also gives a good NS1-based cell-mediated response, which results in prevention of severity of dengue. So by and large, theoretically, seems to be an ideal vaccine. So to put this into test, so there were comprehensive trials which were done. One of the large-scale trial, which was called the TIDES, which its co-component in adults called the DEN4. It involved 14 different countries across the world, 8 of which were endemic to hyperendemic for dengue. There were phase 1 to 3 clinical trials, close to 20,000 plus or 28,000 participants or more, and the baseline population involved both seronegative as well as seropositive individuals, meaning those who already had antibodies to dengue, meaning they were infected at some point of time, in whom you expect the disease to be severe, and seronegative individuals as well, those who were naive to the infection. Compiling all the data, I'll not go too much into detail of this, compiling all the data, the trial which was primarily done in children, so which was the TIDES, which showed good immune responsiveness, particularly when 2 doses are given. So the timing of vaccine is that you give 2 doses subcutaneous 3 months apart. It induces good beneficial antibody response. The baseline had around 72% seropositive individuals and 28% seronegative ones, and they were followed up for the subsequent 4.5 years after the completion of vaccination to see whether they had symptomatic dengue, proven dengue, whether symptomatic or proven dengue did need hospitalization, and whether any mortality. So the primary endpoint was to confirm whether there was any symptomatic and proven dengue, and it showed that compared to the placebo group, which is non-vaccinated individuals, there was a reduction in disease by about 80%. There was a reduction in hospitalization requirement by about 90%, and this reduction of 90% was sustained over 4.5 years, and there was close to 84% or more reduction in the need for hospitalization, which, like I said, would be an ideal thing with regards to dengue. That is, prevent disease, prevent severity of the disease, and of course prevent hospitalization and mortality. So that's what the studies did show. The adult component of it also did show that the antibody responsiveness is to all the different serotypes, and if you see the graph here, which the blue matches for the children up to 16, and then beyond 18 to 60 was the red graph, the serotypic response to different serotypes is all uniform. So they did show responsiveness to all different serotypes. Because we know that if at all somebody is infected with, let's say, dengue 1, gets hit by dengue 2 later on, so there may be a significant burden of the disease if you already don't have protective immunity. So that's what the vaccine did. It did show protection even in those who were already seropositive. So when you establish efficacy of the disease, the next question that comes in is how safe is the vaccine and how do we safely use across different age groups. So the study clearly showed that the vaccine side effects or significant adverse effects were nearly lesser than the placebo group itself. There were no significant responsiveness with regard to adverse effects. There was no need to hospitalize anybody who had vaccination, and of course there were no vaccine related mortality. So theoretically it becomes one of the most desirable vaccines when it comes to the Indian market. So at the end of the day, you also get to see whether how to phase it. Is one dose enough, two doses enough, whether multiple dosing is required. As of now, the data clearly shows that two vaccine shots, 3 months apart is good enough to induce good amount of immunity and is also good enough to induce a significant response sustained over years. If you give only one dose, the protective rate or the efficacy is close to 85%, but if you increase it to 2 doses, 3 months apart, it comes close to 99.5% and it seems to sustain over many years. So how do we choose the population? Of course, it is currently in different countries accepted for individuals above the age of 4. You give 2 vaccines, subcutaneous, because they are live vaccines, 3 months apart, and you can give it up to the age of 60, which is the current recommendation. As for any live vaccines, the contraindications are the same. So if at all it is any immunocompromised individual, particularly on chemotherapy, individuals with malignancy, or any HIV with a CD4 less than 200, also in women with pregnancy and during lactation, the live vaccine is contraindicated. One other subtle contraindication is if there were any adverse effects to the previous dose of vaccine. So like I said, based on the backbone of this trial, which showed significant responsiveness, effectiveness, and also safety, multiple countries, particularly in the Southern American nation where dengue is quite significant and hyperendemic, they have approved it and they have also integrated as part of their national schedule, particularly in children. And there is a widespread approval given to adults as well in many endemic countries. Bulk of data comes from Southern American nations, particularly from Argentina, where apart from the efficacy data, it also showed the rate of any sort of serious adverse effect with regard to this vaccine was quite close to nothing. Even in individuals more than 60, there was good responsiveness and any sort of adverse effect was not noted at all. Even upward age group of more than 80 were immunized also with this, and the side effect profile becomes better and better, meaning the side effects become lesser if at all you give the second dose and after. So seems to be a good vaccine, accepted and recommended for those more than 4 years of age, and the upper limit seems to be nothing at all. So many countries have already incorporated it. So when it comes to India, it's a matter of guess. I think primary, all the paperwork I believe is going on. The company should be able to elaborate better. To summarize for you, so a live attenuated vaccine, TAC-003, which probably will come down as Qdenga in the Indian market, approved across 42 countries as of now, with the basis of long-term trials with good follow-up, which showed that their ability to prevent disease and severe disease is 80% or more. Their ability to prevent hospitalization or death is 90% or more, and nobody so far with vaccination behind them did not have any death to report. So the real world data is still emerging, seems to be a good effective vaccine. So only when it hits the Indian market and post-marketing analysis will be able to know how it fits into the schedule and whether it will be part of the national immunization schedule, and will we be able to give it to adults without much hindrance and significant side effects. So that would be my time. Thank you for a patient listening.
So you have saved 4 minutes. We are already running short since there is shortage of time. Questions is allowed only in the lunch meet. Thank you very much for your nice, wonderful talk. Thank you, Vinay.
Thank you so much, doctor. I would request the chairpersons and the speaker to move towards the selfie area for collecting the memento and the group photo.